Let's bring in Dr. Dyan Hes. She is the founder of Gramercy Pediatrics. She's going to help us understand what's going on here. So, Dr. Hes, good to see you. Explain from a medical perspective what's happening and how concerned should people be, given that there's already vaccine hesitancy in this country?
Yeah, this is a tough situation. So what they're saying now is if you received the Johnson & Johnson vaccine and you feel like a sudden severe stomach ache, a sudden severe onset of headache or limb weakness, you should contact your doctor immediately. But now, I mean, as we all know, when you think that you've been exposed to something that can cause something dangerous, you're going to be like very edgy and anxiety provoked. If you get a little headache, you might think you're having a blood clot to your brain. So it's not great for vaccine, questioners or people who are resistant to the vaccine, but it's an extremely low number, right? It's probably, I have to say that if it wasn't for COVID and this was a regular vaccine that was rolled out and some numbers like this happened, I don't think they would ever garner this kind of publicity. But because it's dealing with COVID, it's like, oh, Johnson & Johnson is stopped now. So, I think what they're going to find is that the people who do have these clots, they're going to find now that they probably had an underlying clotting disorder. But it's too soon to tell because they're going to have to do blood tests on these 6 patients and analyze if they had a gene that predisposed them to clotting.
So we already know that, nearly 7 million Americans have received this vaccine. What do you say to your patients who are concerned now about efficacy, about their health?
Well, efficacy is completely different. So we've always known that Johnson & Johnson is only about 60 to 66% effective in preventing cases of COVID or the cases that'll lead you into the hospital and death. So Johnson & Johnson has always been lower on my list as a favorite. I know that people loved it because it was only one shot. But when I was speaking to my patients, I mean, first of all, I'm a pediatrician, so the kids can only get Pfizer. But when I speak to the parents, I've been highly recommending the mRNA vaccine over the Johnson & Johnson vaccine. Just in my personal opinion, I think it's better technology. I think people like that the Johnson & Johnson vaccine was marketed as, a traditional vaccine. But traditional clearly doesn't always mean better. I don't think the majority of people are going to have any severe outcomes. I think they're all going to be relatively well protected against COVID. I wouldn't say that they should call their doctor or do anything different unless they have like a severe, like the worst headache of their life. Because this is cavernous sinus thrombosis. It's not like a blood clot in your leg. It's a severe medical issue, and you wouldn't miss it. You're not feeling well. It's in your brain.
So, Dr. Hes, as Emery was saying, I mean, if you are one of the 6 that had an adverse reaction to this vaccine, clearly it's concerning to you, your family, your loved ones. But with regards to the millions of people who have already received it, and we have people in our lives, I certainly do, that I know who have received the Johnson & Johnson vaccine who are fine. And as you point out, if this were any other vaccine or any other infection, we probably wouldn't be using the blaring headlines, the breaking news. But sort of help people understand how, when the CDC and the FDA are looking at the data like this, because the fact that they want to pull these vaccines means that there will only be fuel added to the fire of people who don't want to get vaccinated. And it also means that for states like Michigan, who are asking for more vaccines, that they're not going to have the full range of vaccines available to them.
Yes, but, now I think that you have to choose, it's always about a risk-benefit ratio. And now that we know about these 6, and this is this is not a common occurrence, a cavernous venous thrombosis, and it's definitely happened with 6 patients. So we are obligated as researchers, as doctors, the CDC, to protect lives, right? So they have to investigate this. What I think, like I said, they're going to find, and so, the thing is that everything is happening so fast with coronavirus, and we want to answer yesterday. It takes time. I mean, you're going to have to do genetic sequencing on these patients' blood, or send them to special labs to find out if they have protein C deficiency or protein S deficiency or other underlying clotting disorder. We're not going to find the answer tomorrow. Life is not always fair, and we're going to have to ramp up the production of Pfizer and Moderna and get it out to people. But we can't now, at this point, when there's already vaccine hesitancy, when people are really questioning the government, its role in healthcare, and forcing, whether it's for, like we're going to talk about going to college with the vaccine, there's going to be a lot of questions on the table. So they have to, I think the government is obliged to make the patients feel safe and their citizens feel safe and the vaccine receivers, and they have to investigate this. And it might take a few weeks, but I can tell you now that after these headlines, nobody's going to get online to get a Johnson & Johnson vaccine. I doubt it highly right now until they have answers.
And I think, Doctor, it's not just sort of a headline like this, and even though we're trying to sort of clearly state the facts and also put it in perspective, but it's other things too. We know that a good segment of the adult population in this country have already received at least one shot, but we're still seeing cases skyrocket. In Michigan, that Vlad brought up, is a perfect example. The governor there is begging the federal government for additional doses. The federal government says no. The only thing that's going to help you, because these vaccines aren't going to kick in for several weeks, the only thing that's going to help you is a total shutdown. The governor
Which I disagree about.
Hesitant, understandably. So, this is very confusing to people. How can we have so many people receiving the vaccine doses, but we're still dealing with surges?
Well, I completely disagree that the vaccine is not going to help you, that you have to have a lockdown, because I think that Michigan is, first of all, I think Michigan is in this crisis right now because they had such a severe lockdown. So I think, all the people who were in severe lockdown during the winter are getting exposed to coronavirus now. And sadly, coronavirus has new variants that are much more contagious and a little bit more virulent. So these patients and these people in Michigan who are getting coronavirus are getting sicker, they're getting hospitalized because they were on lockdown. I'm not a firm believer that lockdowns prevent this pandemic. I think it just prolongs it and spreads the bell curve to start much later. So Michigan is peaking now when New York peaked a year ago. But I completely disagree. They need the vaccine. We know that just even getting one vaccine, you might get coronavirus, but you won't end up in the hospital and dying, and even from one. So it would be very, very, very rare. So they need to get the Moderna and Pfizer vaccines to the citizens in Michigan.
So,
and Doctor, the other thing that we've been hearing is that there have been the cases have been ticking up when it comes to kids, younger kids. So I understand that, schools have started to reopen in some places. Kids are being exposed. A lot of kids just got off spring break, so who knows what we'll see in a couple of weeks. But, now that we have this hiccup with the Pfizer vaccine, what's your take on it, the hiccup with the Pfizer vaccine coupled with the uptick in cases with younger kids? What's your take on school reopening plans?
I think that we're still, most of, pediatricians all around the country and doctors want children back in school. The schools are not the sources of the outbreaks. The adults are the sources of the outbreaks. And it's young adults, college students who went on spring break. We are not seeing massive outbreaks in schools. In New York City, we haven't had one school closed because of a massive outbreak. They actually increased the cases now to be allowed to be up to number 4 cases in New York City in schools that are unrelated. You can still keep a school open, because really what we've been seeing is like maybe one school administrator has COVID and one child, but they're totally not related. They both got it from outside the school. You are much safer to be in school. I can tell you that I have 2 kids who are online school who got COVID because their parents didn't want them to send them to school because of COVID, and they're online and they got COVID. And my patients that are in school are not getting COVID, because when you're online, teenagers, kids want to see other people. They leave their house. They go places where they might not wear a mask. In school, you're wearing a mask all day, and your teachers are watching you. You're much safer to be in school. And we have so many crises now with kids killing themselves, suicide, depression, not learning. They need to be in school, and I'm a firm believer of school being opened.
Dr. Hes, before we go, really quickly, I just want to ask you, because people right now, as they're watching us on social media, are wondering, because we're talking now about the availability of Johnson & Johnson, of Pfizer and Moderna being available, doesn't mean that those vaccines themselves won't also have some side effects, right? I mean, there's no vaccine on earth that doesn't have some level of side effects for certain people. Am I right?
Correct. But we've had hundreds of million people now getting the Pfizer vaccine and the Moderna vaccine, and people are doing well with them. I mean, definitely Pfizer. We can see the studies from Israel. It's been very successful. We haven't had any major side effect that would ever stop the chain of, the vaccine chain from moving along. So I think you could feel really safe that if you get the Moderna or Pfizer vaccine, you might be sore, you might be tired, you might have a headache, but within 2 days, all those flu-like symptoms will resolve, and you will be somewhat or more protected from COVID and you still have to keep on masking. And I think that's the biggest thing. You still have to keep on masking.
All right, Dr. Hes, thank you so much for joining us this early in the show.
Thank
Usually
you.
you're a little bit later, but we had this news.
Yeah.
Thank you.
Take care. Bye-bye.